to a lady in her 40s who had essential or primary pulmonary hypertension. These patients are often women between the ages of 20 and 40. The presentation is not of chest pain. They usually do not have a peripheral venopathy of the lower extremities, and the most common symptom is easy fatigability. They have dyspnea at minimal exertion. Plain radiography seen to your left shows slight enlargement of the heart, straightening of the pulmonary artery segment due to enlargement of the pulmonary trunk, and centrally prominent pulmonary arteries. We see very minimal decrease of the pulmonary vascular bed in the periphery of the lungs, but the pulmonary markings are well preserved. On physical examination, they typically have a strong second pulmonic sound, and they may have a right precordial heave. Electrocardiographically and echocardiographically, there is a usual right ventricular thickening of its wall and the right axis deviation. The pulmonary angiogram seen to your top right shows a slight enlargement of central pulmonary arteries and tortuosity of intrapulmonary arteries. This is usually the hallmark of chronic precapillary pulmonary hypertension. The photograph of bottom right is the venous face, which shows synchronous opacification of the pulmonary veins. There was no evidence of flow retardation. And the bottom left is a selective bronchial arteriogram, which shows a very small, normal appearing bronchial arteries. There are no signs of bronchial hypervascularity, which often is seen when the pulmonary hypertension is due to thromboembolic disease. Note in this frontal chest rentgenogram a borderline size heart, prominent pulmonary trunk, and centrally enlarged pulmonary arteries. There are no parenchymal changes and no evidence of venocapillary hypertension. All these findings suggest precapillary pulmonary hypertension. This is a color addition photograph that we did some years ago when we assigned colors to various shades of gray. We can see centrally enlarged pulmonary arteries, and this patient also had primary pulmonary arterial hypertension. Note the absence of yellow in the periphery of the lung and the prominence of the yellow close to the hyla.